Did you know there was a time when drilling into someone's skull was considered a cure for mental illness? The lobotomy ice pick, or more formally known as the transorbital lobotomy, is one of the most controversial procedures in the history of psychiatry. Developed in the 1940s by Dr. Walter Freeman, this method was a radical approach to treating severe mental illness. The idea was to sever connections in the brain's frontal lobes, which were believed to be responsible for emotions and behavior. Freeman's technique was shockingly simple. Instead of the traditional surgical method that required drilling into the skull, he used a common kitchen tool, a simple ice pick. He would insert it through the eye socket, using a hammer to drive it into the brain. This method was quick, often taking less than 10 minutes, and could be performed in an outpatient setting. It was marketed as a miracle cure for everything from depression to schizophrenia. But the results were far from miraculous. Many patients emerged from the procedure with drastic personality changes, often becoming apathetic or emotionally flat. Some experienced severe cognitive impairments, losing their ability to think critically or engage socially. The procedure was often performed without proper consent, and many patients were left with irreversible damage. Freeman traveled across the country, performing lobotomies in hospitals and even at county fairs, promoting it as a quick fix for mental illness. At its peak, thousands of lobotomies were performed annually in the United States. However, as the years passed, the medical community began to recognize the ethical implications and the often devastating consequences of the procedure. By the 1950s, the advent of antipsychotic medications provided a more humane and effective alternative for treating mental illness. The lobotomy ice pick became a symbol of a darker time in psychiatric history, a reminder of how far we've come in understanding mental health. Today, we look back at the lobotomy with a mix of horror and disbelief, recognizing it as a cautionary tale about the importance of ethical standards in medicine and the need for compassion in treating those who suffer from mental illness. If you like more interesting and shocking facts, subscribe to this channel.